Hi, my name's Louisa, and I'm a harm reduction health educator at MaineGeneral. This video series covers roots of drug use, and today I'll be talking about snorting. So we'll first learn about how the snorting high works, and we'll talk about some commonly snorted substances. Then we'll discuss some of the risks associated with snorting, and I'll provide some harm reduction techniques. So snorting is when you inhale a substance through your nose. Substances that are snorted are absorbed pretty quickly into the bloodstream through the delicate skin inside of your nose. This means that the effects associated with a certain drug are felt a whole lot faster when they're snorted than when they're swallowed. In fact, it takes as little as 5 to 10 minutes to feel the effects of a drug after it's been snorted, but when you swallow something, it could take up to an hour to feel that high, because the drug has to pass through your stomach and liver before it can enter your bloodstream and cause a high. This time estimate changes based on the drug that's being taken, the amount taken, and the body of the person taking it. So substances are usually powdered or crushed up if they're going to be snorted, and some commonly snorted ones are coke, prescription pills, heroin, meth, PCP, and more. Some people might choose snorting to avoid the risks associated with other routes of use, or to feel more of an intense high than they might feel if they swallow the same substance. But snorting does bring with it several risks. When substances enter your bloodstream directly through your nose, they don't go through those same filtering processes they would when you swallow something. So a substance's effects will be much stronger and more dangerous when snorted than when swallowed, greatly increasing the risk of overdose. This also means that the high will probably be a little bit shorter. Additionally, just like with injections, there's a risk of Hep C from sharing materials when snorting. Some other complications associated with snorting include damage to the skin inside the nose, a hole forming on the nasal septum, a loss of smell, constant nosebleed, swallowing issues, and a constant runny nose. But you can take steps to minimize these risks by using the low and slow method, cutting a powdered substance in a sanitized and clean area, using your own new straw or card for each hit, taking steps to care for your nose when snorting, and rotating routes of use. So since you can more easily overdose with snorting than swallowing, make sure to use the low and slow method. Start off snorting a small amount and wait a good chunk of time before you take more. Even if you know how a substance affects your body when you swallow it, the effects will be different and more intense when snorted. So it's really important to wait until you actually feel the effects of a drug before snorting more. And always be sure to have Narcan on hand and a friend nearby in case of overdose. So even if you don't think you're taking an opioid, unfortunately, many drugs are laced with fentanyl nowadays. So you can still experience an opioid overdose. But if you have a friend who can give you Narcan nearby, they can reverse your overdose and save your life. Hygiene is also really important when it comes to using substances. If you prep your hit in a cluttered, non-sanitary area, you'll snort up whatever is lying in the surface. To avoid this, make sure to cut your lines in an uncluttered area if you can. You can use an alcohol prep pad to wipe down your prep surface before you consume a substance. Just try to make sure the surface has dried before you snort. And try to use a new straw each time you snort. Pipes, dollar bills, or used straws have likely gone through multiple hands and been contaminated by countless germs or even Hep C. Try to use your own card for cutting lines. This also reduces the risk of cross-contamination and Hep C. You should try to also crush your substance as well. This helps you avoid snorting large, sharp chunks of a substance, which can cause more damage to the inside of your nose. A substance crushed into a fine powder will minimize the damage done to your nose. And insert the straw high into your nose. This again will help avoid getting the substances stuck in your nose hair and causing damage. Some medical professionals even recommend adding a bit of water to your prepped hit in order to avoid some of the damage the sharp powder causes. Try to rotate nostrils between hits in order to avoid damage to one side of your nose. Try to rotate routes of use. Avoid continually snorting without letting your wounds heal. This could aggravate the wounds and lead to more forms of infections. Instead, try to rotate ways of consuming drugs. You can check out our videos located in MaineGeneral's Harm Reduction YouTube playlist on other routes of use. Thanks for joining me today. We learned about how snorting works, some commonly snorted substances, some risks associated with snorting, and some risk reduction techniques. At Next Step Needle Exchange, we offer a variety of supplies, including sterile waters and Narcan. These materials help create a safer environment for drug use and reduce the risk of complications. Thanks for joining me today, and I invite you to check out more of our videos located within MaineGeneral's Harm Reduction YouTube playlist.